Did you know the early symptoms of HIV can often go unnoticed? Welcome to Alpha Nutrition. Today, we're discussing the main symptoms of HIV to help you recognize the crucial signs for early detection and treatment. Human immunodeficiency virus, HIV, can develop into a life-threatening condition. It works by damaging your immune system, which in turn can seriously trouble your immune system into battling infections and diseases. Actually, what is the main symptoms of HIV? HIV is normally contracted by being in close contact with someone who already has the virus, often through the transmission of bodily fluids. Unprotected sexual contact or sharing needles, which is common with drug users. Another way the virus can be transmitted is through the mother whilst pregnant or through breastfeeding. However the virus is contracted, it's important that we understand what the main symptoms of the virus are. So we've made this helpful guide to help you know what signs to look out for. HIV symptoms and development. HIV progresses especially when no treatment is sought out for the virus. To understand the symptoms, it's best that we go through the stages of the virus and explain what you may notice. Acute HIV, primary infection. Within 2 to 4 weeks after the virus has been contracted by a person, many people will exhibit some flu-like symptoms which could potentially last for several weeks. This is known as acute HIV and can present itself through the following symptoms. 1. Headaches. 2. Fever or high temperature. 3. Muscle pains and aches. 4. A sore throat. 5. A rash that won't go away. 6. Joint pains. 7. Diarrhea and vomiting. 8. Swollen lymph glands, especially near the neck. 9. A painful cough or recurring cough. 10. Night sweats. 11. Unexplained weight loss. It's important to note that these symptoms during this stage can be so incredibly mild that many people may not even notice them. However, if the virus is not noticed and treatment is sought, the virus can quickly develop into the next stage. Chronic HIV, clinical latent infection. This is the stage of HIV infection when the virus is highly present in the white blood cells and in the body generally. This stage of the infection can also be symptomless and can last for several years. Over time and even with treatment, it's possible for the virus to develop into the next stage. Symptomatic HIV infection. During the progression of the HIV virus, your immune cells are becoming more and more damaged and the development of the virus continues as the virus cells multiply. At this point, you may start to show some of the following symptoms from mild infection to chronic signs of infections. 1. Fever and high temperature. 2. Severe fatigue. 3. Unexplained weight loss. 4. Diarrhea. 5. Shingles. 6. Swollen lymph glands and swollen lymph nodes. 7. Oral infection, thrush. 8. Pneumonia symptoms. Once the virus has reached this stage, it can quickly progress into the next stage, especially if no treatment has been sought out. The next stage is stage 3. HIV stage 3. AIDS. Deaths from AIDS have reduced due to treatments, research and knowledge. Many people with HIV do not develop AIDS, but some do if they don't seek treatment. In 8 to 10 years without treatment, a person may develop AIDS. This is when the immune system has been severely damaged and leads to other diseases or illnesses. These are called opportunistic infections. Some of the symptoms at this time can include the following. 1. Sweating. 2. The chills. 3. Fever that keeps coming back or does not go away. 4. Chronic diarrhea. 5. Extreme fatigue and weakness. 6. Significant weight loss. 7. Strange white spots on your tongue. 8. Skin rashes that do not go away. 9. Swollen lymph glands. What causes HIV? HIV is caused by a virus normally down to sexual intercourse, sharing needles, close contact with the infected through blood or saliva. In some cases, blood transfusions have been performed and lead to the contraction of the HIV virus with patients. How AIDS develops. AIDS is usually confirmed by doctors when the CD4 T cell count falls below 200. This is normally after around 10 years of having the HIV virus untreated. Doctors may also diagnose someone with AIDS if they have a complication which can define AIDS, such as a very serious infection or cancer. How HIV does not spread. Due to many misconceptions, it's important that we inform you of how HIV does not spread. We know some of the main causes as shown in this guide, but below are some of the myths. The virus cannot be spread by 1. Normal skin contact, hugging, handshakes, etc. 2. Water. 3. Bug bites. Who is at risk of HIV? Anybody can contract HIV, but there are some high-risk groups. These include the following. 1. People with STIs. 2. People who have unprotected sex. 3. Drug users. 4. Those with a weakened immune system already. What is the first sign of HIV? If you think you may have contracted HIV, get tested so you can begin treatment. Symptoms vary, but can include fatigue, swollen lymph glands, fever and chills, open sores in the mouth, penis, anus, weight loss, diarrhea and rashes. In women there may also be menstrual cycle changes and early menopause, as well as bone loss. Symptoms can differ with medication. These symptoms are common in people with acute HIV, but not everyone gets them. Early HIV symptoms can be similar to those of common illnesses, such as the flu. However, if you have a fever and other flu-like symptoms, it is best to see your doctor. What are some early symptoms of HIV? Early symptoms of HIV include fever, diarrhea, muscle aches, changes to menstrual cycle and swollen lymph nodes. Flu-like symptoms such as chills, sweats and fatigue may also be present and last for weeks. People with HIV may experience an itchy rash on any part of their body and open sores in the mouth or anus that can be painful that last a few days to weeks. It is important to consult with a medical professional if you have any of these symptoms so you can receive proper diagnosis and treatment. What are the signs of HIV in man? Early symptoms of HIV in men include flu-like illness, oral problems such as thrush and candidiasis, nausea, vomiting and diarrhea, skin rashes and pain while peeing. It is important to get tested for HIV before starting a new sexual relationship. Tests are available at medical clinics, substance use programs and community health centers. Symptoms of HIV positive in females. Symptoms of HIV in women who has HIV will experience different symptoms and complications than a man with the virus. For example, women have a higher risk of developing cancer and osteoporosis. Women may also experience menstrual disruption. A woman's immune system is weakened during an HIV infection. This makes her vulnerable to other infections. As a result, she will have a harder time fighting off bacteria and fungi. Some of these infections can cause severe symptoms. Women with HIV may develop a yeast infection, called oral candidiasis. This infection causes a thick white coating to form over the mouth. It also causes pain and swelling. Women with HIV are also more likely to develop cervical cancer. They should be screened every year. AIDS-related cancers are usually more aggressive than cancers in people without the disease. Another common symptom is a rash. Rashes can appear on the skin in various shapes, such as pink breakouts or boils. The rash can last for 2 to 3 weeks. If the rashes do not clear up within a few days, seek medical help. Women with HIV have a higher risk of heart attacks. Heart attacks can cause pain in the back, neck, jaw, or stomach. Other symptoms include headache, nausea, shortness of breath, and fatigue. In addition, women with HIV have a greater risk of developing sexually transmitted infections, STIs. These STIs include gonorrhea, chlamydia, and genital herpes. A woman's menstrual cycle can be disrupted and skipped. She will also have more vaginal infections. Besides causing pain, these infections can be hard to treat. HIV can remain undetected for many years, but if you have been exposed, the first symptoms usually appear in the early weeks of infection. These include flu-like symptoms such as fever, fatigue, and a sore throat. Other signs may include digestive problems like diarrhea, herpes infections, and opportunistic infections, which are illnesses that occur because your immune system is weakened. Some people also develop cancers. Treatment includes antibiotics and staying hydrated. If left untreated, it can progress to AIDS in as little as 10 years. It's important to seek medical attention if any symptoms appear. HIV urine symptoms. HIV infection can cause a wide range of symptoms, from mild to severe, including fever, vomiting, diarrhea, muscle aches and night sweats. A rash is often visible in the inflamed areas of the body. Women may experience vaginal yeast infections and men may be at risk for liver and kidney disease. An opportunistic infection such as tuberculosis, TB, is a serious complication associated with HIV and can lead to death if left untreated. Pneumocystis pneumonia is another type of fungal infection commonly seen in those with weakened immune systems. Early diagnosis and antiretroviral treatment are recommended to help prevent the spread of the virus. The bottom line: HIV can progress and show lots of different symptoms throughout its cycle. It's important that you know these symptoms and what to look out for. If you, or someone you know is showing any of these symptoms or suspects they may have somehow contracted HIV, it is critical that you seek out medical advice as soon as possible.